Introduction to Oral Medicine. Oral medicine is a specialized discipline within dentistry that focuses on a provision of dental care for medically complex patients and the diagnosis and management of medical disorders involving the mouth, jaws, and salivary glands. Offering care to the patient seeking diagnosis and treatment is a responsibility that entails both broad and detailed knowledge and should only be provided by a healthcare professional and with appropriate training and experience. Obtaining, evaluating, and assessing a patient's oral and overall health status is the obligation of treating oral health care professional. The process can arbitrarily be divided into four major overlapping parts, that is, information gathering, establishing a differential and final diagnosis, formulating a plan of action, initiating treatment, and follow-up. Information gathering. Gathering the information necessarily for establishing the diagnosis of patient's chief complaint, assessing the influence of the patient's systemic health and patient's oral health, detecting underlying systemic conditions that the patients may or may not be aware of, providing a basis of determining whether dental treatment might affect the systemic health of the patient, providing a basis of determining necessarily modification to routine dental care, monitoring known medical conditions. Evaluation of cases includes chief complaint, which is the main reason for patients seeking the care, history of presenting illness, elaborating the chief complaint with a duration, medical history, family history, personal and social history, review of the system, which may include respiratory system, cardiovascular system, gastrointestinal system, genitourinary system, and musculoskeletal system. Extraoral examination. Generalized appraisal of the patient, which includes face, submandibular lymph node areas, parotid areas, temporomandibular joint areas, ears, neck and cervical lymph nodes, and thyroid gland. Intraoral examination. Intraoral examination involves lips and corner of the mouth, mucous membranes of the lip, labial and buccal vestibule, gingiva, buccal mucosa, papilla of the ducts, hard palate and palatal gingiva, soft palate, tonsillar areas and posterior pharynx, tongue, papillas, floor of the mouth and lingual gingiva, teeth. Establishing a differential and final diagnosis. Before establishing a final diagnosis in the orofacial region, formulate a differential diagnosis based on the history and physical examination findings. The disorders includes differential diagnosis will determine which laboratory tests such as biopsies, blood tests, imaging studies that requires to reach a final diagnosis.